So, for this presentation, we are going to go over anosognosia, what it is, how it relates to Alzheimer's disease, any conclusions that we've drawn from the data we found, and a case in which a patient with Alzheimer's was aware of his symptoms and was able to articulate and document his point of view. To state it as it is, anosognosia is when someone is unaware of their own mental health condition or that they can't perceive their condition accurately. Anosognosia usually occurs in a large proportion of patients with mild Alzheimer's disease, and its frequency increases with the progression of the illness. So, in terms of diagnosis, there have been many strategies and instruments that have been validated to assess anosognosia in Alzheimer's disease. However, there is no real consensus in the best diagnostic strategy. Researchers have found that anosognosia in Alzheimer's disease is a significant predictor of apathy and is significantly related to lower depression and anxiety scores, meaning that people who are unaware of their disease are actually more indifferent. Now, to look at it from a structural point of view, studies using different imaging modalities have demonstrated an association between anosognosia and dysfunction in the frontal, temporal medial, and temporal parietal regions.
For anosognosia, we looked at the study that compared FES and EMC scores from patients and their families. So I'll explain what those scores are on the next slide. But for now, let's look at the demographics. So there were four groups in the study. There was the CDR0 group, so that's clinical dementia rating of 0, the group that scored zero point 0.5, and then two different Alzheimer's groups, a mild to moderate and a moderate to severe. So the EMC is the Everyday Memory Checklist, which is an evaluation scale for awareness of forgetfulness. So this can be performed by the patients, caregivers, or the families of patients. And the scores tend to show that patients evaluate their forgetfulness lower than caregivers or family. So you can see the scores down here where the mild to moderate Alzheimer's group scored their forgetfulness at an 8.5, whereas the family members did 14.8, and then the other groups, like the dementia rating of 0, were a lot less, and then this kind of an in-between, and of course as the severity goes up for Alzheimer's, the numbers go up as well. But this did show that families rated a lot higher, but these patients with dementia and with Alzheimer's are some degree aware. So the next measure that they looked at was the falls efficacy scale, and this was the short version of this test that they did, and this thing measures the fear of or concerns about falling. And previous studies show that patients with cognitive impairment have a higher fear of falling than healthy patients, and that Alzheimer's patients actually have less than normal fear of falling. And then the scores that they got in this study show not exactly that the Alzheimer's patients have less of a fear of falling, but still these numbers are a lot closer than the Everyday Memory Checklist. So this shows the patient and family is a lot more similar for those with memory issues, and actually a lot less for the so-called control group. So in conclusion, the awareness of the fear of falling increases with Alzheimer's due to the preserved emotional awareness, whereas the awareness of cognitive impairment is impaired due to memory deficiency. So the way this conclusion was reached was because the FES, or false efficacy score, for the Alzheimer's patients and their families were pretty similar. So if we go back and look at that slide, the scores here are pretty close together by less than a point off, whereas the awareness of cognitive impairment was significantly different between the patients and their families, at almost close to twice for these families. So the study showed that the anosognosia with Alzheimer's is significant, and it can be contrasted to other awareness like fear of falling, which does not involve memory.
This then leads us to Greg O'Brien's case, in which is actually quite the opposite of a patient with anosognosia, because Greg O'Brien was fully aware of his disease, and this could either be due to his familiarity with the disease, since both of his parents had the gene, However, it could also be because of his book that he wrote, which is called On Pluto Inside the Mind of Alzheimer's. It's actually the first book written by an investigative reporter embedded inside the mind of a person with Alzheimer's, um, which is actually chronicling the progression of his own disease. So, as we said before, agnosignosia is a predictor of apathy and lowers depression and anxiety scores. However, with O'Brien's case, he was fully aware of his disease, which actually led him through a period of severe depression and suicidal tendencies. So now that we've learned about agnosignosia, its demographics, and some differences between people with agnosignosia and Alzheimer's and people who aren't aware that they have Alzheimer's, hopefully that gives you all a better understanding of how the two go hand in hand.